All right, let's jump right into a really powerful diagnostic sign you can find at the bedside with just an ultrasound probe: lung hepatization. I'm telling you, this one finding can be a total game changer for quickly assessing the chest. So in this explainer, we're going to break down exactly what it is and what it's telling you.
So picture this. You've got a pretty common scenario. A young man comes in, and everything is pointing towards community-acquired pneumonia. You need a fast, clear picture of what's happening in his lungs, so you reach for the ultrasound. This is a real-world clinical puzzle, and the clock is ticking.
You put the probe on his chest, and that image popping up on the screen, that's your first major clue. Are you seeing the usual signs of a healthy, air-filled lung, or is there something else going on? This is exactly where point-of-care ultrasound just shines, giving you answers right then and there.
And what you might find is a sign we call hepatization. It's got this perfectly descriptive nickname, the lung looks like liver sign. And yeah, that name tells you pretty much everything you need to know. That's the core idea we're going to unpack.
So what's actually happening here? Well, in a bad infection, like pneumonia, the body's immune system just floods the lung's air sacs, the alveoli, with inflammatory cells and fluid. All that stuff pushes the air out, and the lung, which is normally all spongy, becomes dense and solid. So on the ultrasound screen, it starts to look a lot like the dense texture of the liver.
Okay, so here's the key difference in a nutshell. A healthy lung, it's full of air, and air scatters ultrasound waves, creating these visual artifacts. You don't really see the lung tissue itself. But in a hepatized lung, that air is gone. It's become solid, consolidated, and that lets you see it clearly. And what does it look like? Just like organ tissue.
So, how does this actually look on the screen? It's not just some vague resemblance to the liver. There are very specific visual clues that all add up to create this classic tissue-like pattern.
And to be sure you're looking at true hepatization, there's a really simple 3-point checklist you can run through right there during your scan. Let's walk through it.
It's a really logical progression. First, you'll notice the normal A lines. You know those horizontal artifacts you always see in an air-filled lung? They're just gone. That's your first big clue. Second, the lung tissue itself will look solid, with a really consistent, uniform texture. And finally, you make that crucial comparison. Does the lung's echotexture, the way it reflects the ultrasound waves, now match the liver's? If it does, you've found it. That's hepatization.
Okay, so you've identified hepatization. Awesome. Now comes the most important question. What does it actually mean? Finding the sign is just step one. Understanding what it's telling you clinically, well, that's where this skill becomes really powerful.
I mean, why would a lung become this dense and solid? When you see this sign, it's pointing you directly towards a significant underlying problem, often a serious one that needs your attention right away.
The number one cause, the leading culprit, is lobar pneumonia. That's where an entire lobe of the lung gets infected and filled up with all that inflammatory gunk. You can also see it in severe tuberculosis pneumonia. Basically, any condition that causes such a dense, airless consolidation of the lung can create this classic sign.
All right, let's boil all of this down to one simple, practical takeaway. Because when you're in a busy clinical setting, you need a mental shortcut that's fast and, actually reliable.
Here it is, the single most important thing to remember. When the lung looks like the liver, think consolidation. It's that simple. This direct association is such a powerful tool at the bedside because it immediately points you towards a diagnosis like pneumonia.
Look, finding hepatization at the bedside isn't just some interesting visual. It's a critical piece of the puzzle. For our young patient with suspected pneumonia, this one finding can confirm the diagnosis in minutes, right there. So the real question for you is, how can you use this sign to speed up your diagnosis and really change the course of care for your next patient?